Diets fail for numerous reasons. Mostly, it is bad habitus in terms of what we eat, what time we eat, and the quantity of the foods that we eat, and also our selections. There's also, as everyone well knows, there's a psychological component to it. So, under stress, under duress, which has been obviously noted for the last 10, 11 months, the tendency is to eat higher carbohydrate foods, thus providing high levels of serotonin, and they fill that what is well known as the comfort food um, type of menu. However, doing those types of foods later in the evenings inevitably will lead to failed diets and or weight gain. And it's well known is hypothyroid. Now remember that with hypothyroid and hyper, that means fast and slow, you can't have weight gain with either one. If you're running hypo, which would be a slow thyroid, your metabolic burn rate is obviously going to be decreased. So the amount of calories in very well can get stored. Subsequently, you're going to have more adipose tissue, aka you're going to gain weight and you're going to gain body mass and fat. Ironically, sometimes with some people, hyperthyroidism, meaning a fast thyroid, will cause you to retain all the calories you're eating for the simple reason that you become in a stress flight type syndrome. So your stress hormones increase, aka cortisol, etc. And long story short with that is that can cause fluid retention, subsequently more weight, and you may be craving more of those serotonin or serotonergic type foods, aka the pastas, breads, carbohydrates. Thus, you're going to create the issue of weight gain. Other metabolic issues will come with diabetics. So you may all of a sudden realize that you're craving more sugars, more fluids, you tend to urinate more. In that case, you might want to get checked for if you've entered into the realm of hyperglycemia and or a combination of issues would be hyperglycemia, meaning high blood glucose, and possibly what the other problem would be metabolic syndrome, which would be increased cholesterol and triglycerides. So these are issues that really need to be looked at and ruled out as factors that may cause weight gain. So we always try to work upstream. And by doing that, we look at, is there a secondary issue or tertiary issue of why you may have gained weight? If you're honest and you're on a diet, you've tried all sorts of various diets, and as we all know, there's probably top 10 type diets out there. If you've tried one, then you may want to try another. If it's failed and you've gone through a few of these and you really have stuck to them, done food diaries, etc., then it's probably helpful to do some additional testing. Ironically, food allergies can cause weight gain. If you have a food allergy or a food allergen that you tend to be eating more of on a daily basis, let's say that happens to be you're allergic to, we'll take a common one, which would be wheat. If you tend to be eating a high gluten type diet, what can happen is you're going to get a histamine response. Subsequently, you're going to have more fluid retention, and you might notice that you have actually gained weight from eating a highly allergenic type diet. So a simple food allergy test can be done to determine if that happens to be one of the issues causing your weight gain. And obviously, as we talked about before, rule out some of the metabolic conditions that can be causing weight. Thyroid, high blood glucose, aka high blood sugars for some individuals, and whether you're running more of a hyperlipidemic or i.e. cholesterol and triglycerides. So always work upstream, especially if you've been doing the standards and you still haven't gotten to where you need to go. One of the things that could very well be helpful, kind of to reset your uh, problems that you've been dealing with, is to do a detoxification. So, detoxification is fairly simple. They're medically supervised, and there's guidelines that you're given to do it. I always suggest if you decide to utilize a medical detox type diet, that you go to, once you have gone on that, you go to the supermarket, get whatever foods you might need for that, shop, prepare for it, start that perhaps on a Saturday, on a weekend. Thus, it's easier to do that type of detoxification type diet. They tend to eliminate what we call, as we were discussing, food allergens. Subsequently, you may notice that within the first week or so, you've lost anywhere from 3 to 5 pounds. The second week, you may have a little bit less, but they tend to be helpful to reduce the excessive fluid and also to reduce some of the cravings that we have for certain types of foods. Second issue, second item that we offer is we do offer, for some people, they do tend to do fairly well with weight loss injectables such as B12, choline, and inositol. There's mixtures that do, for some patients, help with weight reduction. A brand new item that has recently turned up is AOD 9604. It's a peptide injectable that has some past clinical research that looks promising for weight loss. So that's another item that we do offer, along with making sure that the diet that you have chosen after you've gone through a detoxification is the right diet for you, and that we have worked upstream if needed to rule out any other type of secondary pathologies and or problems causing the weight gain.